Welcome to the SCR Connections webinar. Thank you everyone for joining us. It is my pleasure to introduce our guest speaker, Patricia Bordie. Patty Bordie is the Director of the Area Agency on Aging of the Capital Area and Aging and Disability Resource Center at the Capital Area Council of Governments. There she oversees Older Americans Act services and specialized information and system navigation services for streamlined access to long-term care. Ms. Bordie has spent her career in the Aging Network, serving older adults and their caregivers in local, regional, and state-level programs. Her tenure includes program and policy development in evidence-based prevention and wellness interventions, caregiver support programs, and service delivery models which promote successful aging in place. I'm now going to go ahead and pass moderator privileges to Patty and let them get started.
Thank you, Brian. I'm very happy to be here today. Before I go ahead and get started with the presentation, I just want to give y'all a little bit more information about what the AAAs are and what they do, and I'll be brief. In Texas, we have 28 AAAs, but there is a nationwide network of area agencies on aging funded through the Older Americans Act legislation and implemented since 1965 to provide the same core set of services. So if you're not in Texas, you do have access to an area agency on aging. We all provide a grassroots level of service for older individuals, and our definition is 60 years or older, and the caregivers, family caregivers who support them. So the Area Agency on Aging of the Capital Area provides services that support and advocate for the health and safety and well-being of older adults across our 10-county region here in the capital area of Texas, with Austin as the hub. But we also serve, a number of rural counties. We are the trusted community source for information and referral, as I said, for individuals 60 years and older and their caregivers. We have several direct service programs, including benefits counseling, which are specially trained information and referral experts in the areas of public benefits and Medicare enrollment. We have a care coordination and caregiver support program providing in-home services for individuals following a health crisis or caregivers seeking respite care, education, personal care support, or health and wellness programs. Some of our health and wellness programs that we provide include evidence-based disease self-management and falls prevention workshops. The last core service is the Ombudsman program, and this is in existence in all AAAs or through contracts, and these are specially trained advocates for residents in nursing homes to ensure that the residents' rights of individuals are being respected and upheld. Most AAAs also fund the nutrition, the Meals on Wheels programs, and transportation services throughout their regions. Our particular AAA also has a new program called the Aging and Disability Resource Center of the Capital Area, and that center provides information and referral to individuals of all ages seeking information and guidance around long-term services and supports. So that's us in a nutshell, just so you know. And if you want to find the Area Agency on Aging in your area, the quickest way is to go to www.eldercare.acl.gov. I didn't want to start without making sure I let you all know who we were. So here we go. I got interested in this topic of resilience mainly as I was doing some case management and care coordination myself. I saw individuals with very similar situations, and then I would see some that were coping better than others. So I thought, this is real interesting to me, how some people seem to fall apart in the same situation in which other people seem to rise above it. And I started to wonder what was that about, and started to do a little bit of research into the idea of resilience, because it seemed to be, it was the individuals and what they brought themselves that made the difference. So I wanted to just first tell you that the resilience that we're talking about isn't the one that you might be familiar with. A lot of resiliency talks about community resiliency today. And I believe y'all might have had some webinars about emergency preparedness and response. This isn't that community-based resiliency, although you'll see later on we'll talk about how it's sort of related. But we're talking more about individuals and how they deal with their personal situations. So some people, as y'all know, view the glass half full, and some view the glass half empty. And this has always been an intriguing, notion to me, and it seems to definitely have impact on the outcomes for the individuals that we serve. Individual resilience, as defined by the American Psychological Association, is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, or it's also bouncing back from difficult experiences. So that's the type of resiliency I'm speaking about today. Some of the literature, and I loved this analogy of resiliency as sort of a ride down the rapids, and a river that may have some rapids and is sometimes smooth, so you're going through life and you're not having any issues, and then all of a sudden you hit the rapids and you have to adjust. And then it gets smooth again, and then you come back again and have to adjust. So, just like this kayaker has to adapt to handle the threat, a lot of our older adults especially are dealing with, perceived threats every day and perceived and sometimes chronic stress every day, just dealing with some of the challenges they're faced with in the aging process. So, there are certain domains called the psychological determinants of health, which control somewhat how we deal with something. So these domains include internal domains, sort of, my view about quality of life, stress, anxiety, depression, my perceived social support, and locus of control. This is the idea, locus of control is the idea of, I control certain things, and other things I do recognize are out of my control. And to be healthy, I really need a balanced locus of control, so I need to understand that those things are out of my control are just that. And I need to be able to figure out a way to work with that. The second thing is that psychological determinants of health, these internal domains, significantly affect health outcomes and mortality, along with the social determinants of health. And those are things that some of you might be familiar with, are the domains that impact our health and our positive health outcomes, which really aren't related to the clinical health services that we receive. So it's things like transportation, my education level, my housing situation, my family support, my health literacy, how well do I understand what is being told to me, all of the, my nutrition, are my other needs being met? Even my need for maybe some utility assistance, some rental assistance, are those needs being met so that I can work on improving my health? Because all of those needs significantly impact my health outcomes. Individuals who self-report higher levels of self-satisfaction and stronger networks and lower stress are more likely to utilize preventive care. So that's why these internal domains are so important. Individuals who report higher levels of depression and less social support present high utilization of costlier types of health care. And all of us have our own significant perceptions of our own health. And it's these perceptions that are going to control my success with my own aging. And it's all, and I can't stress enough, it's all highly individual. Every bit of work that we do here at the Area Agency on Aging is with a person-centered focus and the understanding that not one size fits all and that everybody's world is really, and everything we do is really from their point of view. The perceptions of an individual's health really do impact success. Participants that were interviewed during this study, these participants spoke about bouncing back and about dealing with illness rather than being defined by it. Some participants spoke about maintaining independence. That was their priority. Health has both the psychological and the social components. And those new to health challenges, and this one I found particularly interesting, the nurses, this is in Geriatric Nursing, I believe, this article, and it's cited at the bottom. The one thing that really surprised me was that they told readers, make sure you pay close attention to the individuals who are new to having health challenges, because they are the ones that sometimes have a harder time. They haven't had anything bad happen to them, so they really don't know how to cope with it. Their perception is, this new thing that's happened to me is the end of the world, and I really don't know how to deal with it. So they sometimes subjectively view their situation as worse than those who are challenged with chronic diseases who have over time figured out a way to cope. So, and giving social support was seen as important as receiving social support. And that's one of the other things that, if you take nothing away, that was a new thing that I really had not given much thought to, and now I'm starting to hear it everywhere, that, the idea of helping people, fostering resilience in individuals is important in terms of helping support them and their needs, but equally as important is finding opportunities for them to provide social support. That seems to just be more effective. Resiliency, the good news about resiliency and individual resiliency is that it's an adaptive process. It's not a stable trait. It's something that we all have capacity to build. And in our aging network, we spend a lot of time really trying to help people problem solve. And that's exactly what this adaptive process is. It reflects a model of active problem solving and really helping people figure out within themselves how they can solve a problem. It's an adaptive process where the individual assimilates optimism and perseverance, creativity, and positive growth, even in the face of adversity. It takes, we learn skills in communication and also in problem solving. This process also increases the capacity to manage strong feelings and impulses and helps people recognize the coping mechanisms that they may already have and that they may also learn to really deal with some of the problems. There is a scale, and if you look at the citation at the bottom, Sinclair and Walston, they have created what's called the Brief Resilient Coping Scale. And it is actually available for any of us to capture and use in situations. And what it does is just quickly give you a, idea. Is this person a low resiliency coper, a medium resiliency coper, or a high resiliency coper? And it's really can be used for the individual themselves to even self-score and say, yeah, maybe I am able to cope with things. I just don't recognize it. So these 4 bullets are the 4 questions that are asked, and the questions are asked with scale of 1 to 5, the first being it does not describe me at all, and the last being it describes me very well. So the first question says, I look for creative ways to alter difficult situations. Regardless of what happens to me, I believe I can control my reaction to it. The third one, I believe I can grow in positive ways by dealing with difficult situations. And 4, I actively look for ways to replace the losses I encounter in life. So this is just a quick, 4-question survey that can be added to other surveys that individuals might be doing. And we've begun to try and incorporate this in our home visits to really just remind people, you know, you do have some of these coping skills, and we're going to help you reawaken those and work towards problem solving. So that's one way to assess resilience. The other way would be to talk to people about, you know, what have you tried in the past to accomplish your goals? And you might include some of these questions in any type of assessment or conversation you might be having with an older adult or anybody. Most of this work, just for an aside, most of the work on resilience has been done, you know, more with younger individuals and also veterans, people dealing with trauma and abuse and those types of situations. It isn't until recently that they've started really focusing on resiliency around older adults. So I didn't mention that earlier, I just wanted to mention it. One of the other things you might ask somebody is, if we worked on a goal today, how would you know it's working? What would other people notice and see that has changed in your situation? And the third would be, can you see any potential barriers to meeting your goals? How might we address the barriers ahead of time? And the important thing to remember in most of this is that, you know, that the idea of from the individual's point of view is the most important thing. As I said earlier, we do some health and wellness classes. We do evidence-based classes, which means they are designed to work if you implement them exactly the way that they are designed. And every single one of those classes is focused on the goals and the insights and the self-management for the individual. So it's what they want to do, it's how they perceive things. It's really about their viewpoint and their goals. And it's the same with assessing resilience. It's really bringing it back to that individual and reminding them of where they're at and the potential of where they could be, you know, and where they want to be. So that's one of the most important things when dealing with older adults, is to really keep bringing it back to them and their goals. And, you know, the disability community has, you know, not about us without us is one of their mantras, and I tend to agree with that with older adults. It really needs to include the individual in the process of bouncing back. You know, how would they do that? Dr. Donald Meichenbaum was one of the premier scholars around resilience, and he cites a number of fitness factors which contribute to an individual's point of view around, you know, their own resiliency. So he says, and these are the factors that we as helping professionals or family members or, you know, friends to older adults can really help them with. So the first one is physical fitness factors. And so these are the ones that it's exercise, depression, any physical activity, that really helps reduce the depression, the anxiety, and the stress. Several studies in the review that I did cited, you know, that physical activity had a high level of impact on the ability of an individual to cope with a situation. In Alameda County, California, they studied 8,000 individuals, and they were tracked for 26 years. And those who did not exercise were 15 times more likely to be depressed. In a Finnish study, they studied 3,400 people who exercised 2 to 3 times per week, and they reported being less depressed, less angry, less cynical. And in a Dutch study, they also found that exercise decreased anxiety and increased folks' more outgoing natures. So physical activity, we can't stress enough, is very important to controlling and learning new ways of coping. The second fitness factor that Meichenbaum identifies is the interpersonal factor. So this is the idea that social inactivity can impact brain function. Social isolation is one of the newest focal points for all of us in the aging network. There have been recent studies that have identified that social isolation is more dangerous than smoking 15 cigarettes a day. So it's really on everybody's radar now. It's not even just older adults. There's a lot of studies being done about social isolation for younger people too. And I believe it's in Great Britain where they've established a minister of loneliness so that they can really work on the issue because they've identified it as well. So the interpersonal is extremely important. It's extremely important to engage people wherever you can and to really work with folks to make a gift of their own experiences. A personal situation that I had was, you know, as a case manager, I always made sure, and I instruct my new care coordinators, you know, before I left the house, you would be in a home, you would have done an hour-and-a-half assessment, you would have learned a lot about this person's life, about, you know, who they were, where they came from. Lots of people would share their work history, they would share their family history, they would, you know, and there was always something that I would learn that I did not know before I went into that house. And so we always made a point of saying, thank you so much, Mr. So-and-so, for sharing that particular piece of information or that story, or I learned so much from you. And you would just watch people's faces light up because it was probably the first time in a long time that somebody said, thank you for that gift that you gave me. So that's a really important function, you know, that we all can share with each other every day, just that idea of recognizing people's gifts and acknowledging them. The next fitness factor recognized by Meichenbaum is the emotional one, trying to work with people to bolster their emotional regulation, name them in order to tame them. So instead of, you know, ignoring what's going on, try to really name it, recognize it, and then work on strategies. He does a lot of work with, you know, memorializing what you've lost, deal with the trauma, deal with the loss of function if you're an older adult, but try to work to reframe it or re-story, you know, rewrite what you might be dealing with, facing the fears and putting a little bit of a different spin on it. In our evidence-based wellness classes, again, we do a whole lot of education around how do you deal with your difficult emotions at having a chronic disease. Also, how do you, you know, we do a lot of training around the connection between the brain and the body and the idea that your thoughts and whether they're positive or not, you know, and also making a plan to just do one step at a time can really turn around that emotional turmoil and really help bolster that emotional regulation, which then leads to better outcomes and more resilience. The next fitness factor is cognitive, and so this is to really work with the individuals to engage in active problem solving, to help them change that story, build on the strengths, and reawaken old skills. There's a lot of work around just reminding people that you can still grow and learn at any age. Reminding people that, yes, tell me about your past. Tell me about what you struggled with. Tell me what you did then. You know, how did you solve those problems? Some of the more promising cognitive interventions in the aging network right now are, you know, around CBT, so cognitive behavioral therapy, and different types of projects and programs that are really more about problem solving than long-term counseling about a past problem. So, you know, or a past issue or a trauma that happened. It's more about where are we now, what's the problem, what would you like to do with this problem, and how can we get there? And there's been a lot of success around using that type of therapy with older adults because you can definitely see some quicker returns, and you solve one small problem, and then, you know, you recognize, oh, I do have this, I got this, I solved this problem, let's go on to the next one. The next fitness factor is behavioral, helping folks to work to regain independence, volunteer, maybe it's journaling. The behavioral piece of it is the piece that Meichenbaum recognizes where you can do that restoring, that reauthoring your life, he says. You know, talk about examples with the individual and the times when they did have success in coping and remind them, you know, that they can do that again. And, you know, and it's not, you're not ignoring what you've been through, you're not denying what you've been through, it's just a way to reframe it and talk about some of the successful things that happened to actually bring you through that. Then I think this is the last one, is spiritual, and this is, he states, to reflect on cultural examples of intergenerational resilience, identify personal values, life priorities, and to share them, and to use positive religious coping responses, of course, based on the individual themselves. So this one is really interesting in that he speaks a lot about, you know, the importance of working with older adults, especially to offer those opportunities for intergenerational communication and really the storytelling across the generations to remind them, the older individuals, yes, we lived through some really tough times and here's how we did it. And then, you know, the added value is then really working with that younger generation to teach them about resilience and about ways of coping and ways of working through some of life's struggles. And by telling stories across generations as well, it's another one of those opportunities to be giving those gifts that we talked about earlier. You know, it's really a way of the older adult to say, yes, I still have something to contribute, and I'm willing to do that. And I see the importance of it, and then it really does bring about better health outcomes for them. We talked a little bit about social isolation, and throughout all the literature was this common thread of the importance of strong social supports. Recently, I read another article, though, that took a really interesting spin on it, where they talked about even those tangential kind of daily interactions that we have, you know, with the bus driver or with the, you know, person that we're buying coffee from, or with, you know, one of our neighbors that we don't talk a lot to, but they walk by, we walk our dog, we say hey. Even those really what seem like minute and quick and, you know, not so deep interactions are of value, you know. So just really any opportunities that we have to make sure we get people into spaces with other people, it's just so important. But again, it's all with that person's person-centered goal to do so. Some people are always going to, you know, prefer, I've got my house, I've got my 4 dogs, that's my company, that's where I want to be, and, you know, all of this is under that umbrella of respect for what that person, you know, makes as a choice. And so that's, you know, that's very important when we're doing any of this work. But the benefits of social supports include, you know, the provision of emotional comfort. It's also the provision of information. So you're providing some education as to, you know, where might I be able to go to see and get some information about this particular artist that I love. And then it's also the instrumental. As area agencies on aging, we spend most of our time with this instrumental piece, with trying to break down the barriers that get in the way of me, older adults, finding the social supports that I need. So we, as I said, provide transportation. We also, you know, connect people to local programs that can help provide social support. We try to, you know, if it's a piece of equipment they need to increase their mobility, we'll get them that. So we do spend a lot of time on that instrumental piece, but we also participate in the other two as well. The other benefit is better health behaviors, as stated in that earlier slide. If I perceive myself to have stronger social supports, I'm going to be more likely to go and get my preventive health care because I'm going to want to stay well so that I can continue to participate in my social experiences. So it does lead to better health behaviors. And then you also have peers. You're engaged with your peers or you're engaged with your family, so you've got somebody else there to help bolster you, to help, back up the fact that you're doing well, that you're solving problems, that you're engaged. The evidence-based classes also are led predominantly by peers, and that's why, because you have that peer support there to really encourage you to continue with your better health behaviors. Stronger social supports show higher self-rated levels of health. It shows better adherence to lifestyle modifications. I want to get out there. I want to be engaged. I want to stay engaged. So I'm going to make sure I'm eating well. I'm sleeping as I should. I'm not smoking. I'm really keeping track of my lifestyle. And if I have a chronic illness, I'm really doing the things I need to try and take care of that. Strong social supports also lead to better cognition. So I have, and there's plenty of studies about just staying engaged, being engaged, really helping with my cognitive functioning and brain health. And the obvious one, it promotes less loneliness. So how can we help? And these, were developed mainly from an aging network point of view, but I would argue that every single one of us with older adult family members, friends, neighbors, can help with all of this. And that given the demographics and the demographic imperative and the growing population of older adults, we are all going to have to play a role in really helping to support the older adults living in our community. So the ways that we can help are to really remove barriers, the things I was talking about. If we can help with transportation. In Austin and in a lot of communities, there are Drive a Senior programs, and they are always looking for volunteers to take seniors to medical appointments, to take them shopping, to take them, to really stay socially engaged. We can remove barriers to cost, try and make neighborhoods more safe. Austin also has we have an age-friendly Austin initiative, and I sit on the Commission on Seniors, and so we are really focused as a city on making the city more safe for older adults, making the environment improved so that if I do want to go to a park, it's safe and it's walkable and it's well lit and it's open and available at the hours that I can be there, and I have transportation to there. So that's an example where as a community, as community members, you can all get involved in really making sure that communities are accessible for older adults. And in our work with Age Friendly, we really have determined that what you do for older adults typically benefits everybody else in the community. So better sidewalks for me as an older adult really helps the mom who's pushing twins in a stroller. So that's the other added value to that. We can also increase social supports and both the opportunities to receive, but the opportunities to give as well. A lot of the work in recent years around engaging older adults has been around and in the areas of social justice and of community change and of, really advocacy. So we've got community gardens in Austin, and the older adults are encouraged to participate, and then they're there with younger folks and families, and then it becomes an intergenerational opportunity, which, we always love to see that because engaging the generations, the younger generations learn as much from the older adults and as the older adults learn from them. So it's really that opportunity for the older adult to give back. We can also try to reduce the risk factors, depression and isolation. As aging network providers, that's really our job. But I think, as individuals in a community, it's our job as well to really reach out to that older adult neighbor you might have and just check on them every once in a while and invite them and engage them in whatever opportunities are happening in the neighborhood. We can provide, and we do as an aging network, try to provide as much peer support as possible to our older adults. Faith-based communities play a huge role in this as well. A lot of faith-based communities have what they call senior ministries, and so they're already actively engaged in providing group activities, education, training, but they're also the ones that are definitely and typically taking on home visits and, you know, wellness checks. If something's going on with somebody, they're the ones checking. We also help develop goals, you know, and as families, I think families can also help develop goals for the older adults to try and get them more engaged and to try and help them recognize their coping mechanisms that they have and help them to better problem solve with the situations they might be dealing with in a chronic illness or in a crisis situation. We can ask about the gifts of experience and what they think they bring to the table. We've been doing a lot of community work in one of our counties called Bastrop County, and also in another county, I had the same experience. It was the Parks and Recreation, and these were even the grounds people. These were the people that kept the park, you know, clean and green and groomed and landscaped and kept the trash picked up. And they both stood up in these meetings I was at about, we were talking about volunteers, and we were specifically talking about, you know, older adults and their opportunities to volunteer. And both of these gentlemen stood up and said, you know, we never ask people, what is it that you think you could bring to this park, to this project, to this community? You know, he said, we just assume that they're going to reach out and ask us and volunteer, you know, automatically. And we know a lot of times that doesn't happen, and the likelihood of people, you know, wanting to volunteer and seeking it out, it just increases when somebody reaches out and says, you know, I've heard your story, and it sounds like you've done a lot of really, you know, you have a lot of skills that I could use as the parks manager. What is it that you think you could bring? And so that's one way of engaging and really prompting the older adults to say, yeah, I do have a lot of skills, and I think I can still do this. Maybe not to the extent I did when I was younger, but I can certainly be there to help be a foreman or to help with some ideas. So that's just one example of, even outside of an aging network, these park folks really did identify older adults as, you know, a gold mine for volunteering, but they really recognize that we have to ask. We can't wait for them to come raise their hand and volunteer. Anytime we can incorporate physical activity, that's helpful. We talked a lot about that and the evidence that absolutely makes a difference in people's ability to cope and to increase their capacity for resiliency. And then reminiscence and really listening to those stories. This time in older adults' lives, there's, you know, the theory of Maslow's hierarchy, and the very tip of the top of the triangle is the notion of generativity. And so as we age and as we get closer to the end of our life, we are really seeking as human beings, you know, what is it have we done? What is it that we left? What is our legacy? What did we not accomplish? You know, what's left for us to do? You know, what when we move on is going to remain of us? And so reminiscence can play a real key role in this, in that you're going over, you know, what people have done throughout their life, what they brought to the world, what they brought to their families, what they brought to their friends, but also some of the failures and some of the challenges and how they potentially came through them. So that's really something when you're thinking about and talking to and listening to the stories of your older adults, it's important to remember that's a lot of what they're doing, and it's an important stage for all of us that sometimes we don't recognize. So because I'm from the Aging Network, and you all, like I said, have access to an area agency on aging, maybe some of you have age-friendly initiatives in your area, or you have commissions, maybe you don't, maybe you have a task force, maybe you're just part of a large faith-based community that has opportunities to engage with older adults. But I'm just going to give you a couple of our local examples of programs and ways that the Aging Network has helped provide solutions. You know, if you have any further questions about this, you know, my contact information will be at the end and you can reach out to me. But these are just some ideas that our local network and some of our national partners have worked on. AARP, all of you probably have heard of them. They have a campaign called Connect to Effect, and it is really a campaign that we all can participate in to try and increase social engagement for older adults. And you would just Google Connect to Effect and you would find that. We have a local in-home support provider in Austin called Family Elder Care. They have a very unique program called Lifetime Connections Without Walls. It's been extremely successful. It's one of those that's broken down that barrier of transportation because it's a telephonic program. So I call in, and it's an educational program, but it's also information and it's also entertainment. So they have everything from, you know, one day they'll talk about travel and someone will bring in their travel photos and they'll talk about their travels. Next day they'll talk about Medicare 101 and the information somebody might need about that. They also play bingo over the phone, which has been highly successful, they say. You know, I'm not necessarily sure how they get the prizes to people, but they assure me they have it all figured out, and that's, you know, well attended. So sometimes they have 100 people on the phone. And it also has that added value of they do mine the people that come on the phone for future sessions. So, you know, they'll ask them, is there something that you want to know about? Is there something you could teach us about? Is there something that you've experienced that you want to share? So there's that opportunity to give gifts again. We all have, a lot of us have RSVP. It's not it's all over the country, but it's not in every county, but you want to look for it if you have one. You know, Retired Senior Volunteer Program, it's called, which also has a component called Senior Companions. Senior Companions, the older adults get a stipend to help other older adults. So that's an added value in that both people are getting assistance. And of course, the older adults who are providing services to others are getting that ability to give a gift. And then foster grandparents is another big program where older adults engage with schools, with institutions, with places where children need support, and they provide that support. I talked earlier about our evidence-based programs. These are all self-managed programs, so they're designed, and every piece of material in the curriculum is designed to really promote that resiliency, that idea that I have control over my chronic disease, and that I do that mainly through action planning. So it's this process where every week the participants will come in and say, I want to work on this problem. You know, I want to eat better. And then I'll set up an action plan that says, well, you know, my one little baby step to do that is to eat one more piece of fruit a day. And that's all, and if that's what they want to do, that's what they do, that's their action plan. So it's very self-motivated, and it is highly successful and extremely life-changing. I'm able to teach several of them, and every time I do, it's very life-changing. And I would say it is that because it is the self-management component, and it teaches people some of these skills that will stay with them for the rest of their lives. So any other peer support interventions are really helpful. The problem-solving interventions that I talked about, one that we've had experience with is run by Dr. Namki Choi at the UT School of Social Work, and she does it all through a telehealth type of methodology where individuals are actually given, you know, iPads, and the conversations and the counseling and the problem-solving therapy is actually done electronically. And one of the interesting things about this is it's been highly successful, but what she noted as an unintended consequence was, you know, they gave them laptops and they loaded it up and they made it so simple and so easy that they could master the process of connecting and unconnecting and moving through and navigating. And she said that she felt that, you know, the outcome of these older individuals actually mastering an electronic piece of equipment, they were just amazed that they were able to do that. So there was even more successful health outcomes because, again, they realized, wait a minute, I got this. You know, I did this, and this was, you know, not as hard as I thought it was going to be. We also have a creative action organization in Austin. It's an arts organization, and they do a writing project for older adults. So I briefly spoke about journaling, and they will do that. They will do storytelling. They will have people actually write their stories down, but they will also have events where they can share their stories. And they will create publications so that they can disseminate those stories. That's been highly successful. And another project, they really use older adults as volunteers in their after-school programs with kids. And that has just been highly successful, they said, for both the older adults and the children. There's a lot more across the network, across the national network, around technology solutions to help promote better engagement and make, you know, stronger connections. And that's just going to increase over time. And the last example is a national example. This one I stumbled upon at a conference, and I find it so intriguing. An architect was trying to get some input from older adults, and he started a small group, a focus group around that. And as he started to become more engaged with them, the one thing most of them were talking about was, yeah, I retired and I used to do this, and I'm retired and I used to do that, and I used to do this. And that's what I really miss is I have no opportunities to do anything that's meaningful or that's purposeful or that helps somebody. You know, so the older adults were talking about this themselves. So he said, well, you know what? I need help. I need help in trying to look at my projects, and you guys can assess and see if they're any good. And he started there, but then he also started having them, you know, decide what types of things do we want to look at and what types of topics do we want to discuss. And that developed this virtual group of longevity explorers where they either have, you know, heady discussions, very philosophical or very broad world, or they were also doing reviews for prototypes of some of the technology solutions. So he's connected some older adult groups to groups of entrepreneurs who are creating all these solutions, and they review the solutions. They review the equipment. They review the new cane or the new adaptive fork, or they review the new watch, you know, and they are now, in some of the areas, getting paid to actually do those reviews. But he said, you know, the major outcome was it finally brought back into individuals' lives the opportunity to really talk about things that meant something to them. And so that's another one that if you just Google Longevity Explorers, you find it, and it's available all across the country for anybody to engage in, you know, virtually. And it's been highly successful. And lastly, I am going to finish with this picture of the Heart of Texas RSVP program to let you know that one of the things their volunteers do, and this was something that they came up with themselves, they have a whole group of volunteers. Most retired senior volunteer programs are very broad-based, and theirs is too. So a lot of the volunteers that participate, you know, work in schools or go and work at a senior center, or they also might do something working in arts and culture. You know, so there's all the more traditional volunteering. They'll deliver Meals on Wheels or drive for somebody. There's all those, you know, what we call typical volunteer experiences. But one that a group of their volunteers identified and started to really act upon and implemented it was a group of volunteers that had vans and had RVs and had, vehicles that they could hop into, and they weren't working anymore, so they could go at a moment's notice. And I think it started up around our recent, when we had Hurricane Rita, we had a couple of hurricanes right in a row, and so they descend upon whatever area is hit, of course, after it's safe to enter, and they really set themselves up to be volunteers after disasters, and to do the things that nobody else can do. And, recognizing that as older adults, they do have resiliency. They have been through struggles themselves, so who better to help other people going through struggles? They also recognize that, they have the time, they have the gifts, and, they say the outcomes have just been amazing for, the actual disasters that they've participated in. But it brings me to the closing, and which kind of connects back to that original picture of we're not necessarily talking about disasters, but more and more there is literature out there that's recognizing that older adults can really play a key role post-disaster and recovery, and also play a key role in emergency preparedness, mainly because of their life experiences and because they're available and because, they do have these gifts to give. So we are focused as a local aging network this year on emergency preparedness, and, we're going to make every effort to make sure that our older adults know how to be prepared, but also know how they might help their neighborhood become prepared. We've had a couple of situations where neighborhood associations have taken upon themselves to actually do drills around, here in Austin we have some issues with fire safety and, concerns over neighborhoods that have one way in and one way out, and so evacuation and plans for evacuating and that type of emergency preparedness has become paramount, and it really has been the older adults in those neighborhoods that are spearheading some of the practice, some of the planning, and actually implementing the telephone trees and the follow-up and doing whatever they can do because they're the ones that are available to do it. So that's been an unintended type of outcome that we're seeing more and more of that. So we're really promoting and suggesting that communities don't ignore the fact that, older adults are there and available, and many of them do have high levels of resilience, and we should really use them as a resource for us and not make the assumption that we have to consistently be there providing for them, but find out what it is they have to give. And with that, there's my contact information. And as I said, you can reach your own area agency on aging through eldercare.acl.gov. And with just that caveat that we all have the same core services, but we might have services that are a little bit different based on our funding, which is based on our population. So the funding formula is what determines the size and scope of services at any area agency on aging. So that's it, and I'm here to take any questions.
Great. Thank you for the wonderful presentation and all the ideas and resources that you presented here. There are a few questions here. We don't have time for a lot, but if you do have questions, I'm going to go ahead and volunteer Patty to take your questions over email if you have anything after this. One person wrote, in my experiences, the services you are describing generally are not available to people above a certain income level. This person is the sole caregiver for a person in declining health. The question is just, is sort of wondering about income limits and how that affects services for the aging.
Thank you so much for asking that question. That's usually the first thing I mention. The The special thing about the area agencies on aging is we do not have income limits. It's funded through the Older Americans Act, so it's not an entitlement program like Medicaid or Medicare, and we really are here to serve anybody. 60 is really the only thing. Particular programs will have eligibility based on need, you know, my need for assistance with a certain activity of daily living, but other than that, anybody can call us. And especially around the caregiver program, caregivers, you know, can be of any age, just helping somebody 60 and older. We also serve grandparents raising grandchildren in that program.
Great. Another question is, where can we get the brief resilience scale?
I have a handout, which I did not send along. I can send that along if that will help. Or you could really just even Google it and you can find it. But I have a handout that's already prepared because it's in the public domain, so anybody can use it now. So if that helps me to get that to Brian and he can get it out, I don't know what's the best way.
Great. Well, thank you so much. We're almost at the top of the hour, so I'm going to go ahead and end the recording right now. Thank you again.
Thank you so much for having me.